196 ದೇಶದಲ್ಲಿರುವ ಕನ್ನಡಿಗರನ್ನ ಒಂದಾಗಿಸುವುದೇ ನಮ್ ರೇಡಿಯೋ.
ನೀವ್ ಕೇಳ್ತಾ ಇದ್ದೀರಾ ಕೆನಡಾ ಡೈರೀಸ್ ವಿತ್ ಆರ್ಜೆ ಪ್ರಶಾಂತ್.
ಕೆನಡಾ ಡೈರೀಸ್ ನ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಇಂಟರ್ವ್ಯೂ ಸೆಗ್ಮೆಂಟ್ಗೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ. ನಾನು ಆರ್ಜೆ ಪ್ರಶಾಂತ್. ನಿಮಗೀಗಾಗಲೇ ಹೇಳಿದ್ದೆ, ಇವತ್ತು ನಮ್ಮ ಜೊತೆಗೆ ಒಬ್ರು ಬಹಳ ವಿಶೇಷವಾದಂತ ಅತಿಥಿ ಇದ್ದಾರೆ. ಐ ಕನ್ಸಿಡರ್ ಇಟ್ ಇಸ್ ಅನ್ ವ್ಯಾಲ್ಯೂಯಬಲ್ ಇಂಟರ್ವ್ಯೂ ಅಂತ ಹೇಳಿ. ಅವ್ರ ಬಗ್ಗೆ ನಿಮಗೆ ಬಹಳಷ್ಟು ವಿಷಯಗಳನ್ನ ಈಗಾಗಲೇ ಹೇಳಿದ್ದೀನಿ. ಆದ್ರೆ ಈಗ ಜಾಯಿನ್ ಆಗಿರ್ತಕ್ಕಂತ ನನ್ನ ಕೇಳುಗರಿಗೆ ಅವ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ವಿವರವಾಗಿ ಹೇಳೋದಕ್ಕೋಸ್ಕರ ಬ್ರೀಫ್ ಆಗಿ ಅವರ ಇಂಟ್ರೊಡಕ್ಷನ್ ನ ಹೇಳ್ತೇನೆ. ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅಮಾನುಲ್ಲಾ ಮೂಲತಃ ಕೇರಳದವರಾದ್ರೂ ಕೂಡ ಸುಮಾರು 1 ದಶಕಗಳಿಗಿಂತ ಹೆಚ್ಚು, ಅಂದ್ರೆ 10 ವರ್ಷಗಳಿಗಿಂತ ಹೆಚ್ಚು ಕರ್ನಾಟಕದಲ್ಲಿ ಇದ್ರು. ಇನ್ನೂ ಸ್ಪೆಷಲ್ ಏನು ಅಂದ್ರೆ ಅವರು MBBS ಮುಗಿಸಿದ್ದು JSS ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಮೈಸೂರಲ್ಲಿ. ಅದಾದ್ಮೇಲೆ ರಾಂಚಿಗೆ ಹೋಗ್ಬಿಟ್ಟು ಅಲ್ಲಿ ಸೆಂಟ್ರಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಸೈಕಿಯಾಟ್ರಿನಲ್ಲಿ ಮತ್ತೊಂದು ಸರ್ಟಿಫಿಕೇಶನ್ ಅನ್ನ ಮಾಡ್ಕೊಳ್ತಾರೆ. ಮತ್ತೆ ಬೆಂಗಳೂರಿಗೆ ಬರ್ತಾರೆ. ಅಲ್ಲಿ MD ಅನ್ನ ನ್ಯಾಷನಲ್ ಇನ್ಸ್ಟಿಟ್ಯೂಟ್ ಆಫ್ ಮೆಂಟಲ್ ಹೆಲ್ತ್ ಅಂಡ್ ನ್ಯೂರೋ ಸೈನ್ಸ್, ಅಂದ್ರೆ ನಮಗೆಲ್ಲ ಗೊತ್ತಾಗೋ ಹಾಗೆ ನಿಮಾನ್ಸ್, ಆ ನಿಮಾನ್ಸ್ ಅಲ್ಲಿ ಅವರು MD ಅನ್ನ ಮಾಡ್ಕೊಳ್ತಾರೆ. ಅದಾದ್ಮೇಲೆ ಲಂಡನ್ಗೆ ಹೋಗ್ತಾರೆ. ಅಲ್ಲೂ ಕೂಡ FRC ಸೈಕಾಲಜಿ ಮೇಲೆ ಸರ್ಟಿಫಿಕೇಶನ್ ಮಾಡ್ಕೊಳ್ತಾರೆ. ಅಲ್ಲಿ ಕೆಲಸ ಕೂಡ ಮಾಡಿ ಕೆನಡಾಗ್ ಬಂದು FRCPC ಮಾಡ್ಕೊಳ್ತಾರೆ. ಇದೆಲ್ಲದ್ರ ಜೊತೆಗೆ ಕಿರೀಟಕ್ಕೆ ಮತ್ತೊಂದು ಗರಿ ಅನ್ನೋ ಹಾಗೆ ಬಹಳಷ್ಟು ಗರಿಗಳಿದೆ. ಅವರು MD ಮಾಡ್ಬೇಕಾದ್ರೆ ನಿಮಾನ್ಸ್ ಅಲ್ಲಿ ಗೋಲ್ಡ್ ಮೆಡಲ್ ತಗೊಂಡಿರ್ತಾರೆ. ಮತ್ತೆ ಪ್ರಿನ್ಸ್ ಎಡ್ವರ್ಡ್ ಐಲ್ಯಾಂಡ್ ಅಲ್ಲಿ ಕೆಲಸ ಮಾಡ್ಬೇಕಾದ್ರೆ ಮತ್ತಷ್ಟು ಕೆಲವು ಅವಾರ್ಡ್ಸ್ ಗಳನ್ನ ತಗೊಳ್ತಾರೆ. ನಾರ್ಮಲ್ ಆಗಿ ಹೇಳ್ತೀವಿ ರಾಜರ ರಾಜ ಅಂತೇಳಿ, ಹಾಗೆ ಫಿಸಿಷಿಯನ್ ಅನ್ನೋ ಒಂದು ಅವಾರ್ಡ್ ನ ತಗೊಳ್ತಾರೆ. ಇಟ್ಸ್ ಅ ಸ್ಪೆಷಲ್ ಅವಾರ್ಡ್. ಅದ್ರ ಜೊತೆಗೆ ಅವಾರ್ಡ್ ಆಫ್ ಎಕ್ಸಲೆನ್ಸ್ ಕೂಡ ತಗೊಳ್ತಾರೆ. ಅಂದ್ರೆ ನಾನೀಗ ಅದ್ರ ಬಗ್ಗೆ ಹೇಳ್ತಾ ಹೋದ್ರೆ ಇಡೀ ಈವೆಂಟ್ ಅದ್ರ ಬಗ್ಗೆ ಹೋಗುತ್ತೆ. ಬಟ್ ಮೈ ಮೇನ್ ಮೋಟೋ ಈಸ್ ಟು ಗೆಟ್ ಮೋರ್ ನಾಲೆಡ್ಜ್ ಫ್ರಮ್ ಶಬೀರ್ ಅವರಿಂದ. ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವ್ರನ್ನ ಮಾತಾಡಿಸ್ಕೊಂಡು, ಅವರು ಸೈಕಿಯಾಟ್ರಿಸ್ಟ್ ಆಗಿರೋದ್ರಿಂದ ಅವರ ಕಡೆಯಿಂದ ನಮಗೆ ಬಹಳಷ್ಟು ವಿಷಯಗಳನ್ನ ಕೇಳ್ಕೊಳ್ಳೋದು ಬಹಳ ಮುಖ್ಯ ಆಗಿದೆ. ಯಾಕೆಂದ್ರೆ ಇವತ್ತಿನ ನಮ್ಮ ಬಹಳಷ್ಟು ತೊಂದರೆಗಳಿಗೆ ಎಲ್ಲ ಮೂಲ ಕಾರಣ ನಮ್ಮ ಮನಸ್ಸು. ಆ ಮನಸ್ಸಿನ ಮೇಲೆ ಏನೇನು ಪರಿಣಾಮ ಬೀಳುತ್ತೆ, ಅದನ್ನ ಹೇಗೆ ನಾವು ಸರಿಪಡಿಸ್ಕೊಳ್ಬಹುದು ಅನ್ನೋದನ್ನ ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವ್ರ ಕಡೆಯಿಂದ ತಿಳ್ಕೊಳ್ಳೋಣ. ಅವರನ್ನ ಈಗ ನಮ್ಮ ಕಾರ್ಯಕ್ರಮಕ್ಕೆ ಆಹ್ವಾನ ಮಾಡ್ಕೊಳ್ಳೋಣ. ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವರೇ, ಕೆನಡಾ ಡೈರೀಸ್ ನ ನಮ್ಮ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಇಂಟರ್ವ್ಯೂ ಸೆಗ್ಮೆಂಟ್ಗೆ ನಿಮಗೆ ಸ್ವಾಗತ.
ನಮಸ್ಕಾರ ಪ್ರಶಾಂತ್. I am very happy to be here. Truly an honor to be invited to this program and to your audience. Thank you so much.
ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವರೇ. ಇದು ನಿಮ್ ದೊಡ್ಡ ಗುಣ. ನಿಮ್ಮನ್ನ ನಾವು ಇವತ್ತು ಮಾತಾಡಿಸ್ತಾ ಇರೋದು, ನಿಮ್ಮಿಂದ ವಿಷಯ ತಿಳ್ಕೊಳ್ಳೋಕೆ ನಾವು ಬಹಳ ಲಕ್ಕಿ ಅಂತ ನಾವು ಅನ್ಕೊಂಡಿದೀವಿ. ಓಕೆ, ಲೆಟ್ಸ್ ನಾಟ್ ವೇಸ್ಟ್ ಟು ಮಚ್ ಆಫ್ ಟೈಮ್. ಬೇಸಿಕಲಿ ನಾನು ನಿಮ್ಮಿಂದ ಬಹಳಷ್ಟು ವಿಷಯಗಳನ್ನ ಕೇಳ್ಕೊಳ್ಬೇಕು ಅಂತ ಇದ್ದೀನಿ. ಅದು ನಮ್ಮ ಕೇಳುಗರಿಗೆ ಅನುಕೂಲ ಆಗುತ್ತೆ ಅಂತ ಹೇಳಿ ನಾವು ಡೈರೆಕ್ಟ್ ಆಗಿ ಹೋಗೋದಾದ್ರೆ, ನಾವು ಸೈಕಾಲಜಿ ಅಂದ ತಕ್ಷಣ ನಾವೇನ್ ಅನ್ಕೊಳ್ತೀವಿ, ನಮ್ಮ ಲೇಮನ್ ಲ್ಯಾಂಗ್ವೇಜ್ ಅಲ್ಲಿ ಯಾರನ್ನಾದ್ರೂ ಒಬ್ರು ನೋಡಿದ ತಕ್ಷಣ ಅವ್ರನ್ನ ಅರ್ಥ ಮಾಡ್ಕೊಂಡ ತಕ್ಷಣ ನಿನ್ ಸೈಕಾಲಜಿ ಎಲ್ಲ ನಂಗೆ ಅರ್ಥ ಆಗುತ್ತೆ, ಈ ರೀತಿ ಮಾತಾಡ್ಕೊಳ್ತೀವಿ. ಆಕ್ಚುಲಿ ಸೈಕಾಲಜಿ ಅಂದ್ರೆ ಏನು ಡಾಕ್ಟರ್?
ಹೌದು, what you said is absolutely correct. ಕೆಲ ಮಿಸ್ಕನ್ಸೆಪ್ಷನ್ಸ್ ಇದೆ ಸೈಕಾಲಜಿ ಬಗ್ಗೆ. ಬಟ್ ಸೈಕಾಲಜಿ ಅಂದ್ರೆ ಒಂದು ಸೈಂಟಿಫಿಕ್ ಸ್ಟಡಿ ಆಫ್ ದ ಮೈಂಡ್. ಫಾರ್ಮಲ್ ಡೆಫಿನೇಷನ್ ಅಂದ್ರೆ ವಿ ಸ್ಟಡಿ ದ ಮೈಂಡ್ ಅಂಡ್ ದ ಬಿಹೇವಿಯರ್ ಯೂಸಿಂಗ್ ಸೈಂಟಿಫಿಕ್ ಟೂಲ್ಸ್. Scientific tools ಅಂದ್ರೆ what types of tools? Observation, rating scales, so experimentation. So when you put it together, you study the mind and the behavior. This is psychology.
ಕಾಲೇಜಲ್ಲೂ ಕೂಡ ನಿಮಗೆ ಇದನ್ನ ಹೇಳ್ಕೊಡ್ತಾರ, ಮೈಂಡ್ ರೀಡ್ ಅಂದ್ರೆ? ಓಕೆ, ಮೈಂಡ್ ರೀಡ್ ಮಾಡೋದಲ್ಲ, ಮನ್ಸನ್ನ ಹೇಗೆ ತಿಳ್ಕೊಳ್ಳೋದು ಅಂತ. ಕಾಲೇಜಲ್ಲಿ ಏನ್ ಕಲ್ತಿರ್ತೀರಾ ನೀವು?
JSS ನಲ್ಲಿ I was doing my MBBS. So ಅಲ್ಲಿ ಡಾಕ್ಟರ್ ಸತ್ಯನಾರಾಯಣ ರಾವ್ ಅಂತ, there is a very famous psychiatrist. He's a wonderful fellow.
Okay.
Satyanarayana Rao was always interested in my doing psychiatry. At time really I had no interest in psychiatry.
Okay.
I was working with Dr. Siddesh, Vasant Kumar, so surgery ಮಾಡಬೇಕಂತ ತುಂಬಾ ಆಸೆ ಇತ್ತು ಮನಸ್ಸಲ್ಲಿ. But Satyanarayana Rao used to always tell me, you should do psychology, psychiatry, you will be good in psychiatry. After finishing from Mysore, I went to St. John's in Bangalore.
Okay.
Just for expert to see. Ali St. John's only I worked with Dr. Srinivas. Srinivas was very good in psychiatry.
Okay.
And then my basics in psychiatry I actually learned from Srinivas. So Satyanarayana Rao was one person, second was Srinivas.
Okay.
So when we talk about psychology, you are seeing two people who understood somebody's potential. It is very interesting. ಯಾಕೆಂದ್ರೆ we always think about doctor and patient interaction, but ಇದರಲ್ಲಿ psychology ನಲ್ಲಿ they were working on another doctor. ಯಾರು? On me. They were trying to show me a different branch. It is so interesting. Psychology, it is a art and science. They teach this in most colleges now. But Indianally, our time really tumba kami the teaching. It was not good enough. But we had excellent training in Karnataka because of NIMHANS. NIMHANS was very famous at that time. Chandrasekhar Rao, there were some very famous people. CRC, very famous. Matte Channabasavana, there were some big people. So what most people don't know is Karnataka was one of the major players in mental health in India. Yes, many people don't realize that. Some of our top psychologists are from Bangalore. We didn't have formalized teaching at that point in time. DPM course, they had a formalized segment, partly psychology. NIMHANSನಲ್ಲಿ you had to do psychology. You had to study developmental psychology. And during our stages of growth, from the time you are born, what is normal, what is abnormal. Is it an abnormality? If that behavior is not developing at that age, is there a problem? That was the whole educational piece about psychology. Psychiatry is you have the biology, not just the studies of observation.
ಅಂದ್ರೆ ಸೈಕಾಟ್ರಿ ಬೇರೆ ಸೈಕಾಲಜಿ ಬೇರೆ.
ಹೌದು, but they're basically together. So psychology is one of the areas we cover in psychiatry.
ಆಮೇಲೆ ನೀವು ಇದು ಡೆವಲಪ್ಮೆಂಟ್ ಸೈಕಾಲಜಿ ಬಗ್ಗೆ ಹೇಳ್ತಾ ಇದ್ರಿ ಡಾಕ್ಟರ್. ಅದು ಡೆವಲಪ್ಮೆಂಟ್ ಸೈಕಾಲಜಿ ಅಂದ್ರೆ ಅಬ್ಸರ್ವೇಷನ್ಗಳು ಯಾವ ಏಜ್ ಇಂದ ಶುರು ಆಗುತ್ತೆ?
Excellent question. So this is important. So for audience also, this is very relevant. ಯಾಕಂದ್ರೆ we often think about ಮಕ್ಕಳು not listening to us. ಚಿಕ್ಕ ವಿಷಯ ಕೋಪ ಬರೋದು, ನಿಜ ವಿಷಯಗಳು ಬರುತ್ತೆ. So is it normal? Is it abnormal? So there are different stages life ನಲ್ಲಿ. So ಕೆಲವು classifications ಇದೆ. One classification is called Erikson. So Erikson, what did he say? He said infancy stage ನಲ್ಲಿ basic trust ಬರಬೇಕು. ಈಗ ನನಗೆ ಊಟ ಟೈಮಲ್ಲಿ ಸಿಕ್ಕುತ್ತೆ, ಅಮ್ಮ ಅಪ್ಪ ಇದೆ ಅಲ್ಲಿ, if I cry somebody will come. Infancy ನಲ್ಲಿ. So that is basic trust. In that stage, if it is not there, he says there will be mistrust. You cannot make friends, you don't trust people. Second stage, toddler stage ಅಂತ ಹೇಳ್ತಾರೆ. Toddler stage ನಲ್ಲಿ ಏನ್ ಬರುತ್ತೆ? Autonomy versus shame. ಈಗ ಆ ಏಜ್ ನಲ್ಲಿ, these children are walking, they will pull this toy, they will pull that toy, they are always very busy. This stage is very important. They develop autonomy. Autonomy means I have the capacity. So if we don't let the child to explore and develop their skills, they develop what is called shame and doubt. They always question their ability to do things. Did I do the right thing? Did I do the wrong thing? So the stage is very important for that. Adadmele barodu preschool age is initiative versus guilt. That means the child takes the initiative to do things versus feeling guilty. Oh, I should not have done that.
ಹೌದು.
After that is school age. So infancy, toddler, preschool, school age. This is where it is very important for us with our children. School age is industry versus inferior. So industry means you work hard, you will succeed. Inferior means, no, I am always going to be inferior to people. So for example, when you started my biodata, you said there are so many things I achieved. Nanna huttirodu Nigeria nalli, Africa. I was born in Nigeria. I speak 7 languages. When I was born there, I realized you need to know the language. So I learned the language there. Then I came to Kerala, I learned Malayalam. Then I came to, and my mother is Tamilian, so I learned Tamil also. Then I learned, from North India, I went to Bihar, I learned Hindi. Learned some Bhojpuri. My best friend was from Punjab, so I learned how to So you can see industry versus inferior. Industry, I had the confidence. I didn't feel inferior to anybody. So this school age is so important because you develop industry versus inferiority. Industry means you work hard, you will succeed. Not because you are arrogant, not because you are bossy, but because you work hard and you will succeed. So this is school age. Next one is called adolescence. Adolescence is where the identity is formed. If you look at the current Western thing, there is so much identity confusion, alwa? What do I do? Do I belong to this? Am I a goth? Am I this? Am I that? And they'll put all that black lipstick and different kinds of things. They have different kinds of identity. Because they don't feel they belong anywhere.
ಓಕೆ.
ನಮ್ಮ ಮಕ್ಕಳಿಗೆ ದಿಸ್ ಇಸ್ ವೆರಿ ಇಂಪಾರ್ಟೆಂಟ್ ಇನ್ ದಿಸ್ ಅಡಲಸೆಂಟ್ ಸ್ಟೇಜ್.
ಹ್ಮ್
ದೇರ್ ಇಸ್ ಗುಡ್ ಕಮ್ಯುನಿಟಿ ಸಪೋರ್ಟ್.
ಹ್ಮ್ ಹ್ಮ್
Otherwise, you will be confused. You won't know what should I do, what should I not do. Okay. Next one is called young adulthood. Young adulthood is where you learn how to develop a good, strong, intimate relationship. If you don't develop this stage, usually you get isolation. So now we have the love stage. The thing is not to make people ashamed, but to be intelligent to select the right person.
Okay.
So intimacy, you don't have to do anything wrong, but it is about trusting people and being close to them. That is why if you see when we come to the West, the friendships we have are still friendships from back home.
ಹೌದು.
You still miss them, alwa? You go there, you have coffee, you go and you buy this laddu, evening time they're making bhaji. All that is very, very important. That culture we don't have as much here. So this is young adulthood. Next, for people like me and you, is middle age.
Okay.
Middle age is generativity versus stagnation. Iga, you are doing this radio show. This shows you're having generativity. Very important. Because if you don't have generativity, you will develop stagnation. Stagnation andre you're not doing anything useful.
Okay.
Kelasaka hogodu, tirga ವಾಪಸ್ ಬರೋದು, you're making some money but nothing useful for society. What you're doing is invaluable. Next stage is called older adult.
Okay.
So older adult stage, you develop what is called integrity. Now, whatever you're doing now, people will remember you for that. They will come and say, Prashanto, you did such a beautiful program. I really enjoyed it. That is, you feel good about it. Integrity versus despair. So some people will be so relentless in making money. Integrity, they will not feel comfortable when they are old because they didn't do anything useful. ಅಷ್ಟೇ.
ಓಕೆ, ಬೇಸಿಕಲಿ ಅಂದ್ರೆ ಇನ್ಫ್ಯಾಂಟ್ ಇಂದ ಅಂದ್ರೆ ನಾವು ಹುಟ್ಟಿ ಮಾರನೇ ದಿನದಿಂದ ಹಿಡಿದು ನಾವು ಸಾಯೋ ತನಕ ಬೇರೆ ಬೇರೆ ಸ್ಟೇಜಸ್ ಅಲ್ಲಿ ನಮ್ಮನ್ನ ಅನಲೈಸ್ ಮಾಡ್ತಾ ಹೋಗ್ಬೋದು, ನಮ್ಮ ಬಿಹೇವಿಯರ್ಸ್ ಗಳನ್ನ ನೋಡ್ತಾ ಹೋಗ್ಬೋದು. ಓಕೆ, ವೆರಿ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಡಾಕ್ಟರ್ ಶಬೀರ್. ಸ್ಪೆಷಲಿ ನಮಗೆ ಬೇಕಾಗಿರುವಂತದ್ದು ಜಾಸ್ತಿ ಬರುವಂತದ್ದು ಟೀನ್ಸ್ ಪ್ರಾಬ್ಲಮ್ ಅಥವಾ ಮಿಡ್ಲ್ ಏಜ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳ ಬಗ್ಗೆ. ಅದ್ರ ಬಗ್ಗೆ ನಿಮ್ಮ ಹತ್ರ ಮಾತಾಡೋಣ. ಅದಕ್ಕಿಂತ ಮುಂಚೆ ನಮ್ಮ ಕೇಳುಗರಿಗೆ ಒಂದು ಕನ್ನಡದ ಹಾಡನ್ನ ಕೇಳಿಸಿ ಮತ್ತೆ ನಿಮ್ ಜೊತೆ ಮಾತು ಮುಂದುವರಿಸ್ತೀನಿ. ನೀವು ಕೇಳ್ತಾ ಇದ್ದೀರಾ ನಮ್ ರೇಡಿಯೋ. ಯಾಕೆ ಅಂದ್ರೆ ಕನ್ನಡ ಕೇಳೋ ಮಜಾನೇ ಬೇರೆ.
ಆನ್ ಏರ್ ಜೊತೆ ಆನ್ಲೈನ್ ಕೂಡ ನಮ್ ರೇಡಿಯೋನ ಲೈಕ್, ಫಾಲೋ ಮತ್ತೆ ಸಬ್ಸ್ಕ್ರೈಬ್ ಮಾಡಿ ಫೇಸ್ಬುಕ್, ಇನ್ಸ್ಟಾಗ್ರಾಮ್, ಟ್ವಿಟರ್ ಮತ್ತೆ ಯೂಟ್ಯೂಬ್ ನಲ್ಲಿ. NAMMRADIO ನಮ್ ರೇಡಿಯೋ. ಯಾಕಂದ್ರೆ ಕನ್ನಡ ಕೇಳೋ ಮಜಾನೇ ಬೇರೆ. ನೀವ್ ಕೇಳ್ತಾ ಇದ್ದೀರಾ ಕೆನಡಾ ಡೈರೀಸ್ ವಿತ್ RJ ಪ್ರಶಾಂತ್.
ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಇಂಟರ್ವ್ಯೂ ಸೆಗ್ಮೆಂಟ್ಗೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತ. ನಾನು RJ ಪ್ರಶಾಂತ್. ನಮ್ಮ ಜೊತೆಗೆ ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವರು ಇದ್ದಾರೆ. ಅವ್ರ ಕಡೆಯಿಂದ ನಾವು ಬಹಳಷ್ಟು ವಿಷಯಗಳನ್ನ ಕೇಳ್ಕೊಂಡ್ವಿ, ಸೈಕಾಲಜಿಯ ಬಗ್ಗೆ ಹೇಗೆ ಆಗುತ್ತೆ, ಯಾವ್ಯಾವ ಸ್ಟೇಜ್ ಅಲ್ಲಿ ಅಂತೇಳಿ. ಈಗ ನಾವು ಬಹಳ ಮುಖ್ಯವಾಗಿ ಬೇಕಾಗಿರೋಂಥ ಒಂದು ಟಾಪಿಕ್ ಬಗ್ಗೆ ಮಾತಾಡೋಣ. ಅದು ಟೀನ್ಸ್ ಪ್ರಾಬ್ಲಮ್. ನಮ್ಮೆಲ್ಲರಲ್ಲೂ ಬಹಳಷ್ಟು ಮನೆಗಳಲ್ಲಿ ಮಕ್ಕಳಿರ್ತಾರೆ. ಅವರು ಟೀನೇಜ್ ಆಗಿರ್ಬಹುದು ಅಥವಾ ಟೀನೇಜ್ ಅಲ್ಲಿ ಇರ್ಬೋದು ಅಥವಾ ಇನ್ನೇನು ಟೀನೇಜ್ಗೆ ಬರ್ತಾ ಇರುವಂತ ಮಕ್ಕಳಿರ್ಬೋದು. ಅವರಲ್ಲಿ ಬಹಳಷ್ಟು ಬದಲಾವಣೆಗಳಾಗ್ತಾ ಇರುತ್ತೆ. ಅದು ನಮ್ಮೆಲ್ಲ ಪೇರೆಂಟ್ಸ್ಗಳಿಗೂ ಒಂಥರ ಹೆಡೆಕ್ ಅನಿಸ್ತಾ ಇರುತ್ತೆ. ಹೆಂಗ್ ಮ್ಯಾನೇಜ್ ಮಾಡೋದು ಅಂತ ಗೊತ್ತಾಗ್ತಾ ಇರಲ್ಲ. ಇದ್ರ ಬಗ್ಗೆ ನಾವು ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವ್ರ ಹತ್ರ ಕೇಳೋಣ. ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವರೇ, ನಾರ್ಮಲ್ ಆಗಿ ಎಲ್ಲರಿಗೂ ಅಂದ್ರೆ ಸ್ಪೆಷಲಿ ಸೌತ್ ಏಷ್ಯನ್ ಫ್ಯಾಮಿಲಿಗಳಾಗಿರ್ಬೋದು ಅಥವಾ ಇಲ್ಲಿ ಅವರೇ ಆಗಿರ್ಬೋದು, ನಾವೆಲ್ಲ ಕೇಳೋದೇನು ಅಂದ್ರೆ ಮಕ್ಕಳು ಟೀನೇಜಿಗೆ ಬಂದಾಗ ಅವ್ರ ಬಿಹೇವಿಯರ್ಸ್ ಚೇಂಜ್ ಆಗುತ್ತೆ. ಅವ್ರು ಏನು ಅಂತಾನೆ ಅರ್ಥ ಮಾಡ್ಕೊಳಕ್ಕಾಗಲ್ಲ. ಅವ್ರು ಸರಿನೋ ನಾವು ಸರಿನೋ ಗೊತ್ತಾಗಲ್ಲ ಅಂತ. ಯಾವ್ಯಾವ ತರ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳು ಬರುತ್ತೆ ಮತ್ತೆ ಅದಕ್ಕೆ ಸೊಲ್ಯೂಷನ್ಸ್ ಏನೇನಿರ್ಬೋದು?
ವೆರಿ ನೈಸ್. ಸೊ adolescent stages between 12 to 18 ಅಲ್ವಾ? ಟೀನೇಜಸ್ 13, 14 ಎಲ್ಲ ಟೀನ್ ಬರುತ್ತೆ ಅದ್ರ. ಸೊ ಟೀನೇಜ್ ಸ್ಟೇಜ್ ನಲ್ಲಿ ತುಂಬಾ ಪ್ರಾಬ್ಲಮ್ಸ್ ಬರಬಹುದು. ಬೇಕು ಅಂತ ಇಲ್ಲ, ಬರಬಹುದು. ಸೊ ನಾವು ಹೆಂಗ್ ಪ್ರಿವೆಂಟ್ ಮಾಡಬೇಕು, ಐಡೆಂಟಿಫೈ ಮಾಡಬೇಕು ಅಂತ ನಾನು ಹೇಳ್ತೇನೆ. ಐ ಟೆಲ್ ಯು ವೆರಿ ಸಿಂಪ್ಲಿ. ಡ್ಯೂರಿಂಗ್ ಅವರ್ ಟೈಮ್ ವಿ ಡಿಡ್ ನಾಟ್ ಹ್ಯಾವ್ ಸೋಷಿಯಲ್ ಮೀಡಿಯಾ. That was actually a huge blessing. We knew how to make friends, we knew how to talk, we were very good in terms of problem solving, and there were so many good things. Social media has created the biggest problem right now. So if we remove social media, what are the common problems? Common problems bandu academic problems. Difficulty in studying, concentration illa, I'm not good in studying, I don't want to study, I'm going to leave university, I don't want to go to school, and they will silly.
ಹೌದು.
Second one is bullying. Bullying also a big issue, alwa? Teenage
ಹೌದು.
high school, things like that. Then drug abuse, depression ಬರಬಹುದು. ಮತ್ತೆ sexual function, sexual issues, pregnancy and so many things, sexually transmitted infections. Then you will get issue with things to do with peer pressure, use alcohol and things like that. So these are the major areas. So how do we identify? Very simple. Depression ನಲ್ಲಿ ಈಗ somebody who is very active, ನಮ್ಮ ಜೊತೆ ಬಂದು ಕೂತ್ಕೊಂಡು ಊಟ ಮಾಡೋದು, those kinds of things will gradually come down. So you will ask somebody, ಭಾಸ್ಕರ್ ಇಲ್ಲಿದೆ, ಅವ್ರ ರೂಮ್ ನಲ್ಲಿದೆ, ಅವ್ರು ಏನ್ ಮಾಡ್ತಾ ಇದ್ದಾರೆ ಅಲ್ಲಿ, ಗೊತ್ತಿಲ್ಲ, the door is closed. You go and call him. You go, you knock on the door, Bhaskar, we're waiting for you. He will say, give some excuse. They'll give some excuse for it. Gradually, you will find they're not taking bath.
Okay.
You will ask him, yes, Snana Madalva. He'll tell you, no, I'm going to take bath, but he will not do it. Gradually, you will find self-neglect. Smelling, not healthy, not brushing the teeth. These are all warning signs of severe depression. So you have to pick it earlier. Second one that you will find is bullying. You will ask him, why you're not going to school? Oh, school nalli enilla friends. So everybody is there. Why you're not going to school? No, I'm not feeling well. So in that age, early teen years, 12, 13, 14, very commonly you may find people saying, I'm not feeling well.
ಹೌದು.
Sometimes you will find even in earlier age groups, 6 years, 7 years, 8 years, they will tell you stomach is paining. Stomach is usually a sign of anxiety.
Okay.
Anta age alli anxiety yaak barabegu? Because of bullying. They are scared of going to school, and bullying is very common.
ಹೌದು.
Now you bring in social media. Social media alli there is cyber bullying. So before it used to be bullying only at school. Okay, I'm not going to go to school. Iga maneyalli the person can be bullied. So previously we could go and talk to the teacher. Now you have to monitor the web. What kind of activity? Before you will see the child has gone out. At 16-year-old child is he has not come back at night. Now that sexual activity can happen even when they are at home. They can take selfie. Naked selfie they can. So these days parents are worried about what things boys are downloading and what things girls are uploading. So we're worried about girls uploading nude pictures, boys downloading these pictures. They're stuck in the room. So this is another big issue. Addiction to pornography, big problem now. In drug abuse, if you don't have good friends and you're feeling isolated, peer pressure definitely birthday. So the friend will come and tell you, oh, I'm smoking cannabis. Oh, cannabis is legal in Canada. Don't worry about it. Nothing is going to happen. You take one puff. Once you start, it will go from cannabis to other drugs. Then it is very difficult. Fourth one is alcohol. Alcohol is now very common here, but also back in Bangalore also. It's a big problem. So alcohol, it is being advertised in a very positive fashion. If you drink, you will make friends. I don't know if you remember, Prashant, but now time it used to be Bacardi.
ಹೌದು.
You remember it, very famous at that time. So at that time, Bacardi's sales in India was very high. Because of advertisement. They were able to show that you make more friends, you will have a good time because of alcohol.
ಹೌದು.
So this created a major problem for many of the teenagers, many of the children. They did not know what to do. So now number 1, isolated. Number 2, cyberbullying. Number 3, peer pressure. Number 4, drug abuse, alcohol use. And now they are not doing well academically. So when you see the child, ಚಿಕ್ಕ ವಯಸ್ಸಿನಲ್ಲಿ very bright, in mark ಎಲ್ಲ 90-95%, now it is going down to 50%, not going to school.
ಹೌದು.
These are all warning signs. Then girls will come, they are having vomiting. ಏನಾಯ್ತು? ಏನಿಲ್ಲ ಡ್ಯಾಡಿ, ಪಾಪ ಒಂಥರ ಸ್ವಲ್ಪ not feeling well. You should go for pregnancy. We often think, no, the child is very innocent. They will do it. We have to be very careful. So always keep the index of suspicion very high. These are some of the common issues that people face with teenagers.
Okay. ಇದಕ್ಕೆ ಸೊಲ್ಯೂಷನ್ ಅಂತ ಏನಿರುತ್ತೆ?
Good family. Very important to have good family. Very important. I cannot emphasize the importance of this more. It is very important as a family. One of the parent has to be strict, no doubt about it. But you don't need to beat anybody, nothing like that. But one parent has to be strict. You have to make sure you have your meals together. ಜೊತೆ ಕೂತ್ಕೊಂಡು ಊಟ ಮಾಡಲೇಬೇಕು. Very important. Have to do that. Don't neglect that. You want to watch movie, sit, no problem. You do that, no problem. But have the meal together.
Okay.
Second thing is socialize with like-minded people. It does not have to be brown people, black people, even your local community. People with similar mentality. Socialize with them. Very important, because you can keep track of your children. They will know how the family is functioning when there is trouble. Very, very important. So if they're angry with you, they can go and stay in, Uncle Prashant's house. I'm going to stay. I'm not very well. No problem. You can play with Prashant's children. No problem. But that network has to be there. Third thing is routine. Routine andre you sleep at 10 o'clock. We wake up at this time. Wake up, take bath, have coffee, sit some time, and then you do whatever you want. These are some of the very simple preventive things. When the child comes back from school, you talk to them. Get to school, Nalli. What did you study? How was it? Was it a good day? Ask them, because the more you talk, you'll get to know about bullying. Very important. Then, an important thing to do is to look at the kind of food we eat.
Okay.
Because if you eat too much of the processed food, many children may consume the red dye. Red dye antavaru idde. Red dye is associated with things like ADHD or abnormal behavior. So certain preservatives are a problem. Matte Coca-Cola idallalli tumba sugar ide. High amounts of sugar itself is a problem. So we have to watch that. Then your sleep pattern, like you go to bed at 10 o'clock, make sure you do activities to prepare for sleep. So good sleep, good family support, good communication, healthy eating patterns, all this will help in preventing mental health issues.
Okay.
100% it is impossible to prevent. ಕೆಲವರಿಗೆ genetic factors ಇದ್ದೇ ಇರುತ್ತದೆ. You cannot do anything about it. But at least you have tried the nurture factors.
Okay.
So these are the simple ones.
ಓಕೆ. ಸೊ ಬೇಸಿಕಲಿ ಮೆಜಾರಿಟಿ ಆಫ್ ದ ಥಿಂಗ್ಸ್ ಏನಿರುತ್ತೆ ನಮ್ಮ ಕೈಯಲ್ಲೇ ಇರುತ್ತೆ. ನಾವು ಹೇಗೆ ಅದನ್ನ ನಾವು ಫಾಲೋ ಮಾಡೋಕ್ಕೆ ನಮ್ಮ ಮಕ್ಳಿಗೆ ಹೇಳ್ತೀವಿ, ಅದರಿಂದ ಬಹಳಷ್ಟು ಪ್ರಾಬ್ಲಮ್ಸ್ಗಳನ್ನ ಸಾಲ್ವ್ ಮಾಡಬಹುದು ಅಂತ. ಫೈನ್ ಡಾಕ್ಟರ್. ಅಂದ್ರೆ ಇದು ADHD ಹೇಳಿದ್ರಿ. ADHD ಇರುವಂತ ಮಕ್ಕಳಿಗೆ ಅಥವಾ ಅದನ್ನ ಬರೋದಕ್ಕೆ ಪ್ರಿವೆಂಟ್ ಮಾಡಬಹುದಾ, ಅಥವಾ ಬಂದ ಮೇಲೆ ಏನಾದ್ರು ಮೆಡಿಸಿನ್ ಇರುತ್ತಾ?
Excellent question. ADHD it stands for attention deficit hyperactivity. ಇದರಲ್ಲಿ ಎರಡು ಕಾಂಪೋನೆಂಟ್ಸ್ ಇದೆ. ಒಂದು ಅಟೆನ್ಷನ್ ಡೆಫಿಸಿಟ್ ಬರುತ್ತೆ ಕೆಲವರಿಗೆ. ಸೊ ಹೆಣ್ಮಕ್ಳಿಗೆ we tend to diagnose ADHD less because we miss it. We don't pay attention to it. But it is there in females also.
Okay.
So ಕೆಲವರಿಗೆ attention deficit becomes the only problem. They are not hyperactive. Hyperactive ಅಂದ್ರೆ ಇಲ್ಲಿ ಕೂತ್ಕೊಳ್ಳೋದು, ಅಲ್ಲಿ ಹೋಗೋದು, they will take this, they will pull that down. ಕೆಲವರು ಮಕ್ಕಳು, if you watch them, they are always like that, very busy. So when you go to friends' houses, the friend will think, what is wrong with this boy? He's disturbing, he's spoiling everything. They will not sit in this. So school, they will get into trouble. They talk too much. Every time they're talking. They will blurt out the answer. They will not think before answering. But they will run across the road. These start at a very early age. Very early age. So it is called neurodevelopmental disorder. Autism, ADHD, oppositional defiant disorder. So oppositional defiant disorder means they will always refuse. Whatever you tell them, they will always oppose you. Always. They will find fault. You tell them to go and put the chair there. Why should I do it? Ask him. These are all early warning signs that something is wrong. Okay? That's for the ADHD. ADHD treatment is there. Psychological treatment is also there.
Okay.
If it is severe, you need medication. Mild, you can try behavioral techniques. No problem.
ಓಕೆ. ಅದನ್ನ ಕೌನ್ಸಿಲಿಂಗ್ ಅಲ್ಲಿ ಹೇಳ್ಕೊಡ್ತಾರಲ್ಲ ಪೇರೆಂಟ್ಸ್ ಗಳಿಗೂ ಕೂಡ, ಯಾವ ರೀತಿ ಅದನ್ನ ಮ್ಯಾನೇಜ್ ಮಾಡಬೇಕು ಅಂತ ಹೇಳಿ.
ಹೌದು, ಡೆಫಿನೆಟ್ಲಿ.
ಓಕೆ. ವೆರಿ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಡಾಕ್ಟರ್. ಅಂದ್ರೆ ಸ್ಪೆಷಲಿ ಟೀನ್ಸ್ ಬಗ್ಗೆನೇ ಜಾಸ್ತಿ ಕನ್ಸರ್ನ್ಸ್ ಇದ್ದಿದ್ದು. ಡೆಫಿನೆಟ್ ಆಗಿ ಬಹಳಷ್ಟು ಕೌನ್ಸಿಲಿಂಗ್ ಅಲ್ಲಿ ವರ್ಕ್ ಆಗುತ್ತೆ. ಇನ್ನು ತುಂಬಾ ಸಿವಿಯರ್ ಆದಾಗ ಟ್ಯಾಬ್ಲೆಟ್ಸ್ ಬೇಕಾಗುತ್ತೆ. ಅದಕ್ಕಿಂತ ಮುಂಚೆ ಅದನ್ನ ಪ್ರಿವೆಂಟ್ ಮಾಡೋದಕ್ಕೆ ಫ್ಯಾಮಿಲಿ ಇಸ್ ದ ಮೇನ್ ಥಿಂಗ್. ಫ್ಯಾಮಿಲಿಯಲ್ಲಿ ಎಲ್ಲದೂ ಚೆನ್ನಾಗಿ ನಡೆಸ್ಕೊಂಡು ಹೋದ್ರೆ ಇದನ್ನೆಲ್ಲ ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಬೋದು ಅಂತ ಹೇಳ್ತಾ ಇದ್ದೀರಾ.
you can cut it down. But genetic factors idre, social factors, so substance abuse or unhealthy diet, difficult environment, those things become very difficult. But if you can keep a good family unit, it is the best protection.
Thank you very much, Dr. Shabir. ಅಂದ್ರೆ ಇಟ್ಸ್ ಅ ವೆರಿ ಗುಡ್ ಸಜೆಷನ್. ಫ್ಯಾಮಿಲಿ ಮ್ಯಾಟರ್ಸ್ ಅ ಲಾಟ್ ಅಂತ ಹೇಳಿ ಇನ್ನೊಂದಷ್ಟು ಮಾತುಕತೆ ಆಡೋಣ. ಈಗ ಟೀನ್ಸ್ ಇಂದ ಮುಂದಕ್ಕೆ ಹೋಗೋಣ. ಅದಕ್ಕೂ ಮುಂಚೆ ಒಂದು ಸಣ್ಣ ಬ್ರೇಕ್ ತಗೊಂಡು ಮತ್ತೆ ನಿಮ್ ಜೊತೆ ಮಾತು ಮುಂದುವರಿಸ್ತೀನಿ. ನೀವ್ ಕೇಳ್ತಾ ಇದ್ದೀರಾ ನಮ್ ರೇಡಿಯೋ. ಯಾಕೆ ಅಂದ್ರೆ ಕನ್ನಡ ಕೇಳೋ ಮಜಾನೇ ಬೇರೆ.
ಅಮೆರಿಕ, ಯುರೋಪ್, ಮಿಡಲ್ ಈಸ್ಟ್, ಆಸ್ಟ್ರೇಲಿಯಾ ಹೀಗೆ ಪ್ರಪಂಚದಾದ್ಯಂತ ಇರುವಂತಹ ಕನ್ನಡಿಗರಿಗೆ ನಿಮ್ಮ ಬ್ರ್ಯಾಂಡ್ ಅನ್ನ ಪರಿಚಯ ಮಾಡಬೇಕಾ? ಅಡ್ವರ್ಟೈಸ್ ಮಾಡಿ ನಮ್ ರೇಡಿಯೋದಲ್ಲಿ. ಹೆಚ್ಚಿನ ಮಾಹಿತಿಗಾಗಿ ಇಮೇಲ್ ಮಾಡಿ advertise@namradio.com.
ನೀವ್ ಕೇಳ್ತಾ ಇದ್ದೀರಾ ಕೆನಡಾ ಡೈರೀಸ್ ವಿತ್ ಆರ್ಜೆ ಪ್ರಶಾಂತ್.
ವೆಲ್ಕಮ್ ಬ್ಯಾಕ್ ಟು ಕೆನಡಾ ಡೈರೀಸ್. ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಇಂಟರ್ವ್ಯೂ ಸೆಗ್ಮೆಂಟ್ಗೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಮತ್ತೊಮ್ಮೆ ಸ್ವಾಗತ. ನಾನು ಆರ್ಜೆ ಪ್ರಶಾಂತ್. ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವ್ರ ಜೊತೆಗೆ ಬಹಳಷ್ಟು ವಿಷಯಗಳನ್ನ ತಿಳ್ಕೊಂಡ್ವಿ. ಸ್ಪೆಷಲಿ ಟೀನ್ಸ್ ಅಲ್ಲಿ ಏನೇನ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳು ಬರುತ್ತೆ, ಮಿಡಿಯೇಷನ್ ಏನೇನಿದೆ ಅದಕ್ಕೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ತಿಳ್ಕೊಂಡ್ವಿ. ಈಗ ಟೀನ್ಸ್ ಇಂದ ಮೇಲಕ್ಕೆ ಹೋಗಿ ನಾವು ಏಜ್ ಆಫ್ 20 ಟು ಹೈಯರ್ ಅಪ್ ಟು ಮಿಡ್ಲ್ ಏಜ್ ಅಲ್ಲಿ ಏನೇನ್ ಬರುತ್ತೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಕೇಳ್ಕೊಳ್ಳೋಣ. ಡಾಕ್ಟರ್ ಶಬೀರ್, ನಾರ್ಮಲ್ ಆಗಿ ಆಫ್ಟರ್ ಟೀನ್ಸ್ ಕೆಲವರಿಗೆ ಮದುವೆ ಆಗುತ್ತೆ, ಆಮೇಲೆ ಮದುವೆ ಆದ್ಮೇಲೆ ಮಕ್ಕಳಾಗ್ತಾರೆ, ಮಕ್ಕಳಾದ್ಮೇಲೆ ಸಂಸಾರಿಕ ತೊಂದರೆಗಳಿರ್ಬೋದು ಅಥವಾ ಕೆಲಸದ ತೊಂದರೆಗಳಿರ್ಬೋದು, ಹೀಗೆ ಬಹಳಷ್ಟು ಮೆಂಟಲ್ ಟೆನ್ಷನ್ಸ್ ಗಳು ಬರ್ತಾ ಹೋಗುತ್ತೆ. ಬಹಳಷ್ಟು ಬೇರೆ ನಮ್ಮ ಫಿಸಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳಿಗೂ ಕೂಡ ಅದಕ್ಕೆ ಮೆಂಟಲ್ ರೀಸನ್ಸ್ ಹೇಳ್ತಾರೆ. ಪೇಷನ್ಸ್ ಕಡಿಮೆ ಇದೆ, ಹಾಗಾಗಿ ತೊಂದರೆ ಆಗ್ತಾ ಇದೆ, ತುಂಬಾ ಆಂಗ್ಸೈಟಿ ಇದೆ, ಈ ರೀತಿಯಾಗಿ. ನಾರ್ಮಲ್ ಆಗಿ ಈ ಮಿಡ್ಲ್ ಏಜ್ ಅಲ್ಲಿ ಏನೇನ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳು ಬರುತ್ತೆ, ಅದನ್ನ ಬರ್ದಲೇ ಇರೋದಕ್ಕೆ ಏನು ಪ್ರಿಕಾಷನರಿ ಮೆಜರ್ಸ್ ತಗೊಳ್ಬಹುದು, ಅಕಸ್ಮಾತ್ ಆ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳು ಬಂದಿದ್ರೆ ಅದಕ್ಕೆ ಏನು ಮೆಡಿಸಿನ್ಸ್ ತಗೊಳ್ಬೇಕು ಅಥವಾ ರೆಮಿಡಿಯೇಷನ್ ಏನು ಅಂತ, ಅದ್ರ ಬಗ್ಗೆ ಸ್ವಲ್ಪ ಹೇಳಿ.
Very important area, Prashant. Very important. Two different aspects. One is generally for men and women, because there is a different way in which men and women react to certain situations, but also expectations idiyalla. So, if he's a boy, certain expectations are there. If it is a girl, certain expectations are there, both culturally but otherwise also. Culturally nodidare, for example, if you have come from South Asia, you are in Canada. Son has to either be a doctor, engineer, lawyer, girl bandre she has to do that, but also she must look very beautiful. She must also be very fair in complexion. Everybody should look like Aishwarya Rai or Padukone. Everybody has to look like that.
ಆಮೇಲೆ ಕಲರ್ ಕಾಂಪ್ಲೆಕ್ಷನ್ಸ್ ಬೇರೆ ಅದರಲ್ಲಿ.
Oh yes. This is a big mistake we make. Confidence ಅಂತ ವಿಷಯ ಇದೆ. It is very important from childhood itself. ಈ ಏಜಿನಲ್ಲಿ it tends to affect the way we look at how we are functioning. So from early adulthood we are going into middle age. So ಮದುವೆ ಆಗಿ ಮಕ್ಕಳಿದೆ, ಕೆಲಸ ಒಳ್ಳೆ ಕೆಲಸ, ವೆರಿ ಗುಡ್ ಜಾಬ್ಸ್, ಮತ್ತೆ ಟ್ರಾವೆಲಿಂಗ್ ಇದೆ, ಬಟ್ ಅದ್ರ ಜೊತೆ ಸಮ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ವಿಲ್ ಕಮ್ ಇನ್. ಸೊ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಸೋಷಿಯಲೈಸೇಷನ್ ನಲ್ಲಿ ಆಲ್ಕೋಹಾಲ್ ಕುಡಿಯೋದು, it has almost become like an expectation. So Bengaluru, if you go for most functions, it is impossible to avoid alcohol. So compulsion ಆಗುತ್ತೆ. ಈಗ ಒಂಥರ I don't want to drink and my wife is there, children are there, how do I avoid it? I want to be good role model. So going from being independent, now you are no longer independent. ಯಾಕಿದ್ರೆ you are married, you have children. ಹೌದು. You are role model, your husband, your provider. Provider, protector, and you're also the person who's carrying the family name. So now a lot of responsibility. Before, what used to happen is you do what you want. You go, you roam around. When you come back home, food is ready. Amma ide, appa ide. You can ask your parents for money, no problem. Oh, you cannot do anything like that. So anxiety will come because you're thinking, how can I provide for them? And then when somebody else is hosting the party, now I have to invite them. I have to put them to my house. My house has to look good. I need a better house. My car should be better than Raghunath's car. I need black Mercedes. The competition barutte. So in middle age, usually people are competing for things that may not provide satisfaction on the long run. This is one big mistake we make. Because we are competing with neighbors, we are competing with friends, the moment we start doing it for these benefits, our pleasure in the small things have gone away. In middle age, the things we should enjoy the most, number one, good health. Number two, if you have a good spouse. Number three, if you have children who don't have any physical issues, blindness, deafness, dumbness, intellectual impairment. The child had any of these problems, Prashant, life would be very difficult. Then we should be looking at the child who has no mental health problem. That is a big blessing. Then your own health, no diabetes, no hypertension. You're not having any leg problem, shoulder problem. These become very important. Then steady job. You have a steady job, good job, you're getting promotions. All these are very important. If you don't have these stages, if you don't have these things, you develop isolation. Matte loss of purpose. So if you read the newspaper nowadays, suicide is there, alva?
ಹೌದು.
Idu cafe, coffee day anta big business was there in India, alva? So he committed suicide. You remember the story? Now his wife took over Hegde and she's running.
Oh yeah. Okay, cafe day. ಹೌದು. ಸಿದ್ಧಾರ್ಥ್.
Exactly. So if you look at it, why did he commit suicide? This was a dream project for him. Now, when we look at it, he's a very rich fellow, he's very successful. But business is very stressful. You know that. You run a business. It is very difficult to run a business. But because you are doing this, you are doing a very important thing for your own well-being. This is giving back to the community. That is a unique combination, Prashant, because most people at this age are worried about making more and more and more and more. You should make. I'm not saying don't make money, but you have to look at your mental wellness. So middle age is the most important age because once you go to old age, you cannot turn back the hands of clock. If you set up right now, own plan to create your wellness, you create a group, you create a media setting, you have good support, you are helping the community. You become old, people will come and tell you, Prashant, it was such a nice thing you did. I really benefited from this. I really benefited. Khushi aguttalla manassinalli. So happy that you don't need antidepressant. At the same time, if you're having marriage problem in middle age, your children are not listening to you, they're using alcohol and drugs, your health is not good, you have obesity, you have alcohol problems, your life is going to be miserable. The best part of your life is gone in trying to solve the problems. So middle age has so many issues that come inside. Majority of them we create.
Okay.
To avoid it, what should you do? Some simple things are there, but very important for us to keep in mind. First thing is, middle age, always remember, old age is going to come very quickly. Always remind yourself. So plan your finances so that you have money. Don't depend on the children. Times have changed. You have to rely on yourself and your house. Both of you have to do that. Second thing is, take good care of your health. Go for a walk. Avoid alcohol. Drink plenty of water. Make sure you sleep very well. Socialize. Don't stay up after 10 o'clock socializing. Come back home after 10 o'clock. Spend some time with your family. Go to bed. Do that. Do something that will help the community. Simple things. If you want to go to old age home, talk to some people, no problem. Because you will feel good about yourself. And the last thing, really relevant, is watch your diet very carefully.
Okay.
Diet is one of the biggest problems now because everybody wants to eat sweets. Sweet matte idu soda, coffee. People drink plenty of coffee. Now we get snacks everywhere. People should learn how to eat in moderation. Enjoy it. Definitely enjoy life. No question about it. Enjoy life, but do it in moderation. Music is very good for health. You can use music in different varieties. So music in ಕೆಲ ಸೌಂಡ್ಸ್ ಇದೆ, ವೈಟ್ ನಾಯ್ಸ್, ಬ್ರೌನ್ ನಾಯ್ಸ್, ಪಿಂಕ್ ನಾಯ್ಸ್, ಬ್ಲೂ ನಾಯ್ಸ್ ಅಂತ ಕೆಲ ನಾಯ್ಸಸ್ ಇದೆ, ಕ್ಲಾಸಿಫಿಕೇಶನ್ ಇದೆ. ಸೊ ಫ್ರೀ ಆಪ್ ಸಿಕ್ಕುತ್ತೆ, ಆಪ್ ಸ್ಟೋರ್ ಇಫ್ ಯು ಲುಕ್ ಅಟ್ ಇಟ್ ಯು ವಿಲ್ ಗೆಟ್ ಫ್ರೀ ಆಪ್ ಕಾಲ್ಡ್ ಲೈಕ್ ವೈಟ್ ನಾಯ್ಸ್ ಇಸ್ ದೇರ್. These noises are very good. Whenever you're having some difficulties, you can put in the background some sound of the water falling, wind blowing, and the chimes. You can just, it is very nice. It will keep your mind more peaceful. The man's there is a thing called, the Chinese call it monkey brain. Monkey
ಹೌದು.
brain ಅಂದ್ರೆ this brain always like exciting thing, gossiping, talking about other people, complaining, but all these things don't help you.
ಹೌದು.
If you gossip about the neighbor, that is the biggest mistake you're making, because it may be fake.
ಹೌದು.
Now you have to deal with that, alwa. So immediately avoid getting into this kind of gossiping. Avoid it completely. Stick to actual information. Stick to simple things at home. Music is very good for health. Listen to nice, pleasant music, preferably instrumental music. It has a good effect on the mind. Though the songs and all are very exciting, alwa. So you feel good for a period of time, but after that it goes away. So if you look at the children nowadays, most of them constantly they're listening to songs.
ಹೌದು.
That is not healthy. Then combining the white noise with doing some form of exercising. You want to do yoga, do yoga. You want to do tai chi, do tai chi. You want to do stretching, do stretching, no problem. But do something. Very important.
Okay.
And the last thing, Prashant, is to make sure your relationship with your spouse is a good one. Because nobody will be with you in old age except your spouse.
ಹೌದು, ಕರೆಕ್ಟ್.
So those are the simple ones.
ಓಕೆ. ಸೊ ಇದನ್ನೆಲ್ಲ ಮಾಡ್ಕೊಂಡ್ರೆ ಮೆಜಾರಿಟಿ ಅಂದ್ರೆ ಇದೆಲ್ಲ ಹ್ಯಾಬಿಟ್ಸ್ಗಳನ್ನ ಪ್ರಾಕ್ಟೀಸಸ್ಗಳನ್ನ ನಾವು ಫಾಲೋ ಮಾಡ್ತಾ ಹೋದ್ರೆ ಮೆಜಾರಿಟಿ ಆಫ್ ಅವರ್ ಇಶ್ಯೂಸ್ಗಳು ನಮಗೆ ಬರೋದೇ ಇಲ್ಲ.
Correct. You can be happy. Correct.
ಓಕೆ, ವೆರಿ ನೈಸ್. ಥ್ಯಾಂಕ್ಸ್ ಡಾಕ್ಟರ್ ಶಬೀರ್. ಓಕೆ, ನಮ್ಮ ಮಿಡ್ ಏಜ್ ಅಲ್ಲಿ ನಾವು ಹೇಗೆ ಮಾಡಿದ್ರೆ ನಮ್ಮ ಜೀವನ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅನ್ನೋದ್ರ ಬಗ್ಗೆ ಹೇಳಿದ್ರಿ. ಈಗ ಅಲ್ಲಿಂದ ಮುಂದಕ್ಕೆ ಹೋಗಿ ಓಲ್ಡ್ ಏಜ್ಗೆ ಹೋಗೋಣ. ಓಲ್ಡ್ ಏಜ್ಗೆ ಹೋಗೋಕ್ಕಿಂತ ಮುಂಚೆ ಒಂದು ಸಣ್ಣ ಬ್ರೇಕ್ ತಗೊಂಡು ಮತ್ತೆ ನಿಮ್ ಜೊತೆಗೆ ಮಾತು ಮುಂದುವರಿಸ್ತೀನಿ. ನೀವ್ ಕೇಳ್ತಾ ಇದ್ದೀರಾ ನಮ್ ರೇಡಿಯೋ. ಯಾಕೆ ಅಂದ್ರೆ ಕನ್ನಡ ಕೇಳೋ ಮಜಾನೇ ಬೇರೆ.
ಕನ್ನಡ ಕೂಟ ನ್ಯೂಯಾರ್ಕ್ ಆಚರಿಸುತ್ತಿದೆ ತನ್ನ ಐತಿಹಾಸಿಕ ಸುವರ್ಣ ಮಹೋತ್ಸವವನ್ನು ಇದೇ ಏಪ್ರಿಲ್ 29 ಹಾಗೂ 30ರಂದು. ಈ ಐತಿಹಾಸಿಕ 50ನೇ ವಾರ್ಷಿಕೋತ್ಸವದಲ್ಲಿ ನೀವು ಭಾಗವಹಿಸಿ ಹಾಗೂ ಚಂದನವನದ ಸ್ಟಾರ್ಗಳ ಜೊತೆ ಸಂಗೀತ, ಸಾಹಿತ್ಯ, ಮನೋರಂಜನಾ ಕಾರ್ಯಕ್ರಮಗಳನ್ನ ಆನಂದಿಸಿ. ಹೆಚ್ಚಿನ ಮಾಹಿತಿ ಹಾಗೂ ರಿಜಿಸ್ಟ್ರೇಷನ್ಗೆ ವಿಸಿಟ್ ಮಾಡಿ kk.ny50.org. ಅಫಿಷಿಯಲ್ ರೇಡಿಯೋ ಪಾರ್ಟ್ನರ್ ನಮ್ ರೇಡಿಯೋ. ಯಾಕಂದ್ರೆ ಕನ್ನಡ ಕೇಳೋ ಮಜಾನೇ ಬೇರೆ.
ನೀವ್ ಕೇಳ್ತಾ ಇದ್ದೀರಾ ಕೆನಡಾ ಡೈರೀಸ್ ವಿತ್ RJ ಪ್ರಶಾಂತ್.
ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಇಂಟರ್ವ್ಯೂ ಸೆಗ್ಮೆಂಟ್ಗೆ ಮತ್ತೊಮ್ಮೆ ನಿಮ್ಮೆಲ್ಲರಿಗೂ ಸ್ವಾಗತ. ನಾನು RJ ಪ್ರಶಾಂತ್. ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವ್ರ ಜೊತೆಗೆ ಮಾತಾಡ್ತಾ ಇದ್ವಿ. ಅವರು ಇನ್ಫ್ಯಾಂಟ್ ಇಂದ ಹಿಡಿದು ಟೀನೇಜ್ ಇಂದ ಹಿಡಿದು ಮಿಡ್ ಏಜ್ ಇಂದ ಹಿಡಿದು ಏನೇನ್ ಮಾಡ್ಬೇಕು ಅಂತ, ಆ ಏಜ್ ಸ್ಲ್ಯಾಬ್ ಅಲ್ಲಿ ಏನೇನ್ ಮಾಡಬಹುದು, ಏನೇನ್ ಮಾಡಿದ್ರೆ ನಮ್ಮ ಜೀವನ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರು. ಇದನ್ನೆಲ್ಲ ಮುಗಿಸ್ಕೊಂಡು ನಾವು ಆಫ್ಟರ್ 60-65 ಬಂದಾಗ ರಿಟೈರ್ಡ್ ಲೈಫ್ ಅಂತ ಅನ್ಕೊಳ್ತೀವಿ. ದಟ್ ಈಸ್ ಆಲ್ಸೋ ಕಾಲ್ಡ್ ಆಸ್ ಅನ್ ಓಲ್ಡ್ ಏಜ್. ನಾಟ್ ಎಕ್ಸಾಕ್ಟ್ಲಿ ದ ಓಲ್ಡ್ ಏಜ್. ಓಲ್ಡ್ ಏಜ್ ಅಲ್ಲಿ ಏನೇನ್ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳು ಬರುತ್ತೆ ಅದನ್ನ ಬರ್ದಲೇ ಇರೋದ್ರೆ ಹಾಗೆ ಇದ್ರೆ ಏನ್ ಮಾಡ್ಬೇಕು ಅನ್ನೋದನ್ನ ಈಗ ಕೇಳೋಣ. ಡಾಕ್ಟರ್ ಶಬೀರ್, ಓಲ್ಡ್ ಏಜ್ ಅಲ್ಲಿ ನಾರ್ಮಲ್ ಆಗಿ ಬಹಳಷ್ಟು ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳು ಬರುತ್ತೆ. ಅದು ಮೆಂಟಲ್ ಪ್ರಾಬ್ಲಮ್ ಅಂತಾನೆ ಹೇಳೋಕ್ಕಾಗಲ್ಲ. ಕೆಲವುದು ಫಿಸಿಕಲ್ ಪ್ರಾಬ್ಲಮ್ ಅದು ಬೈ ಡಿಫಾಲ್ಟ್ ಬಂದ್ಬಿಡುತ್ತೆ. ಅದ್ರ ಜೊತೆಗೆ ಮೆಂಟಲ್ ಪ್ರಾಬ್ಲಮ್ ಗಳು ಸೇರ್ಕೊಂಡ್ರೆ ಇನ್ನೂ ಡಿಸಾಸ್ಟರ್ ಆಗ್ಬಿಡುತ್ತೆ ಲೈಫ್. ಓಲ್ಡ್ ಏಜ್ ಅಲ್ಲಿ ಯಾವ್ಯಾವ ತರದ ಪ್ರಾಬ್ಲಮ್ಸ್ ಗಳು ಬರುತ್ತೆ, ಅದನ್ನ ಪ್ರಿವೆಂಟ್ ಮಾಡ್ಕೊಳ್ಳೋದು ಹೇಗೆ?
Old age is a blessing.
ಬ್ಲೆಸ್ಸಿಂಗ್ಸ್.
ಹೌದು.
Okay.
Because imagine if you didn't have old age, that means you died when you were a kid or you died in middle age.
ಅಲ್ಲ, ಕೆಲವು ಸಲ ನಾವೇನ್ ಮಾತಾಡ್ಕೊಳ್ತೀವಿ ಅಂದ್ರೆ ಓಲ್ಡ್ ಏಜ್ಗೆ ಬರೋದು ಬೇಡಪ್ಪ, ಅದಕ್ಕೂ ಮುಂಚೆನೆ ಹೋಗ್ಬಿಟ್ರೆ ಒಳ್ಳೇದು ಅಂತ.
But ಅದಕ್ಕೆ ಮುಂಚೆ ಹೋಗಿದ್ರೆ you don't see your children getting married, you don't see the grandchildren, alwa. So that also becomes a problem. So if you reach old age, you're very fortunate. Very fortunate, because you have seen life, you have made friends, you have traveled. So it is a big blessing. That is why there is a lot of respect for older people, because you become very wise. Wisdom in old age. Usually teenagerally we are not wise. We are foolish. We do foolish things. Middle age and life is busy. You're working, you're doing this, you're doing that. When you reach old age, you know when you don't need to argue. You will not argue with somebody because you know it's a waste of time.
Correct.
Alwa, you will sit there, you will see the sunset, you will enjoy it even more. So old age is one of the most beautiful parts of our life if you can utilize it appropriately. So to utilize old age, few things are there. First of all, memory. How do you maintain the memory? This is the main challenge. Second thing is maintaining muscle mass. Muscle mass is when you become older, because we don't use the muscle as much, muscle will get wasted. So the problem with muscle wasting and loss of muscle is you develop weakness and you can develop pain very quickly.
ಹ್ಮ್
So when you develop pain, you cannot move. You're having leg pain, you will sit in one place.
ಹೌದು. ಹ್ಮ್
Then you will lose even more muscle because you're not exercising the other muscles.
ಹ್ಮ್
So the only way to prevent this is to make sure you have regular activity.
ಹ್ಮ್
Regular activity can even be when you're sitting and watching TV, you move your leg up and down.
ಹ್ಮ್
Your arms, stretch your arms, move it up, move it in front of you. Rotate your shoulder. Very simple things you can do. Do these regularly. Do stretching exercises. Spend time doing pranayama. Very good for the breathing because as we get older, lung capacity kami aagute. So we need to make sure that we have good lung capacity. So you're not short of breath. But do some physical activity. For memory activity, there are some important things. First is proper sleep. As we get older, like you said, no tension there because how are your children, how are your grandchildren? My son has gone to Canada, daughter has gone to Canada, how are they doing? You will have a lot of worries. Alwa? So to prevent that, you have to think of how it is that you're going to make sure you can sleep at night. Otherwise you're going to be thinking. They call it rumination. Rumination is that one thought will come, next thought will come. For example, what has happened to my son Prashant has gone to Canada. How is he doing there? It is very cold. Suppose he doesn't have a good jacket, he will catch a cold, he will get pneumonia, then he will be admitted to hospital. Going to be very expensive. Then it will come back to the beginning. I should have Prashant not to go to Canada, he should have gone to Australia. Australia, there are many animals are there, snakes are there. Then again you get the worry. So this worrying will prevent you from sleeping. So the best thing to do is during the daytime to keep yourself busy with activities like reading. So read, very important to read. Read, communicate with your family members, but try and read new things. So you can learn something new, you can learn a new art form, you can learn how to speak a new language. All these activities is very good for memory. But also your mind is busy, you can sleep better. Avoid very spicy food because you don't want to develop regurgitation, reflux. You don't want that. Have your dinner very early. Don't have dinner after 7 o'clock in the evening. Have it by 6:30. Have your dinner, no problem. Don't drink too much water after 7:30, 8 o'clock. Otherwise, you have to get up to use the toilet. Drink as much water as you want before. No coffee after 5. Okay, so as little caffeine as possible. Avoid smoking. If you can stop smoking, stop smoking. Yogurt, annasaru, have these things. It is very good for health. Yogurt is fantastic for health. Yes, have yogurt. Culture, if you can bring from India that culture, bring it and keep with you. It is fantastic because you will not get that same culture here. It is very different. So good to do that. So I have one family from Andhra. She has been using the same culture now for almost 20 years.
Okay.
Taste is fantastic. Intestine and our brain, very strong relationship between them. So some foods are very good for health. Balayanu, banana is very good for health. Banana contains very high amounts of tryptophan. Tryptophan is converted to serotonin. Serotonin is what we need for mood, to be happy.
Okay.
But it is also important for sleep. Then avocado. Avocado also is very nice. They like turkey. So Thanksgiving dinner only, local they have turkey. Turkey is very high in tryptophan. So after having it, almost everybody goes to sleep.
Okay.
Because of tryptophan. Not medicine, not sleeping pill. Then avoid alcohol. Alcohol will definitely damage the brain. Now a lot of evidence is there that the alcohol can lead on to dementia. So avoid that.
Okay.
Then there are other foods you can eat that are good for memory. For example, Brahmi is very good.
Okay. Brahmi leaf.
Yes. Brahmi is very important for us. So you get a Himalaya now. If you go to India, you'll get the Himalaya Brahmi. Very nice. You get that in the bottle. Very easily available. Brahmi is good. Ashwagandha is also very good. Good for anxiety as well. It also helps with calming the mind. But if you want, you can have it. The fourth thing that after the sleep and the diet things that you do, to make sure you don't take issues that are not relevant to you. Don't worry about things that are not relevant to you. It will make it so difficult for you at night to sleep. When you wake up in the morning, you're very tired. When you're very tired, you cannot focus. When you cannot focus, poor memory, because you're not paying attention. That is not dementia. That is poor sleep. So to protect your memory, get proper sleep. To protect your memory, eat healthy, avoid alcohol, avoid smoking. All these things together can help. Major problems andre ಒಂದು empty nest syndrome. You know, the children all got married. Nobody is there at home. I am alone. It is important for you to make friendships. So Harvard Nally, they did a very famous study many years ago. They followed people up from an early age to old age to find out who was the happiest. The happiest people were not the richest people.
Okay.
They were the people who had the best friends.
Right.
See, when Nandu was talking to me, Nandu is an amazing guy. He's so humble. So when usually Nandu asks me for anything, I say yes.
Okay.
See, it is not money. It is not, you know, it is that human value that comes from that kindness.
Nija.
That is so important. So build friendships and your old age will be beautiful.
Just before going to the next discussion, Nandakumar, I interviewed him a couple of months back. So, and the person, he's a person like, you know, we can count for anything.
Yes.
Person. Okay. ಡಾಕ್ಟರ್, ಇದು ನಿದ್ದೆ ಹೇಳ್ತಾ ಇದ್ರಿ ನೀವು. ನಾನು ನಿನ್ನೆ ತಾನೇ ನಮ್ಮ ತಾಯಿ ಜೊತೆ ಮಾತಾಡ್ಬೇಕಾದ್ರೆ ನಮ್ಮ ತಾಯಿ ಹೇಳ್ತಾ ಇದ್ರು, ಇತ್ತೀಚೆಗೆ ರಾತ್ರಿ ನಂಗೆ ಒಂದು ಅಥವಾ 2 ಗಂಟೆ ತನಕ ನಿದ್ದೆ ಬರಲ್ಲ, ಆಮೇಲೆ ನಿದ್ದೆ ಬರುತ್ತೆ ಅಂತ. ಅಂದ್ರೆ ಅವ್ರು ಬಹಳ ಆಕ್ಟಿವ್ ಆಗಿರ್ತಾರೆ. 75 years, ಈಗಲೂ ಅವರೇ ಓಡಾಡ್ಕೊಂಡು ಎಲ್ಲ ಕೆಲಸ ಅವರೇ ಮಾಡ್ಕೊಂಡು ಹೊರಗಡೆನೂ ಹೋಗಿ ಬರ್ತಾರೆ, ಎಲ್ಲ ಆಕ್ಟಿವ್ ಆಗಿರ್ತಾರೆ, ಮಧ್ಯಾಹ್ನ ಮಲ್ಕೊಳ್ಳೋದಿಲ್ಲ, ಸ್ಟಿಲ್ ಅವರಿಗೆ ನಿದ್ದೆ ಬರೋಲ್ಲ. ಈ ತರ ಇದ್ದಾಗ ಏನ್ ಕಾರಣ ಇರ್ಬೋದು?
Nice question. So what time does she wake up in the morning?
7:30.
So she is getting about 5 to 6 hours sleep. Actually 5 to 6 hours sleep is not bad.
Okay.
Yeah, it is actually okay. Problem is not about the sleep. Problem is the time she is falling asleep. Yakidre 2 o'clock till 2 o'clock in the morning, what can you do? That is the problem. Okay, so there are some simple things you can take. For example, when we get older, there's a thing called degeneration of the brain. And we have a change in the sleep-wake cycle. So I'm actually giving a lecture on the 21st, Alzheimer's Society of Ontario. It is about sleep disorders and memory problems. So there are about 700 people have registered now.
Okay.
This is purely, so your listeners can are welcome to go to Alzheimer's Society of Ontario. They can register for the program. So this is purely based on sleep. But my advice to your mother will be, tell her not to worry. What she can try and do is to push. You can change the sleep-wake cycle by altering your habits. If she's waking up at 7:30, she can try and wake up a bit earlier.
Okay.
If she wakes up, for example, half an hour earlier every day, then she can go to bed half an hour earlier every other day.
Okay.
Because we're pushing it backward. Then she can sleep between 12 to 6.
Okay. ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಡಾಕ್ಟರ್ ಶಬೀರ್. ಅಂದ್ರೆ ಹುಟ್ಟದಾಗಿಂದ ಹಿಡಿದು ನಮ್ಮ ಓಲ್ಡ್ ಏಜ್ ಅಲ್ಲಿ ಇರೋ ತನಕನೂ ಎಲ್ಲ ಸ್ಟೇಜಲ್ಲೂ ಏನೇನ್ ಮಾಡಬೇಕು, ಏನೇನ್ ಮಾಡಿದ್ರೆ ನಮ್ಮ ಜೀವನ ಚೆನ್ನಾಗಿರುತ್ತೆ ಅಂತ ಹೇಳಿದ್ರಿ. ಕೊನೆಯದಾಗಿ ಒಂದೆರಡು ಮಾತುಗಳು ನಮ್ಮ ಲಿಸನರ್ಸ್ ಹೇಳೋದಾದ್ರೆ.
I'll tell you. So there are a few things here. First is, when we live so that other people benefit from you.
Correct. ಹೌದು.
Because your joy will come from other people. When I go to India now, so many people will call and tell me, Dr. Shabir, thank you. You made me feel very confident. Mysore Nally, I held a competition for Kannada students, just for them. Yakidre, many of them did not know how to speak English properly. So debate or cultural competitions, everybody else used to take part. So one fellow came and told me, Shabir, ನೀವು ಎಷ್ಟು ಜನ ಮಾತಾಡ್ತೀರಾ ನೀವು? So I felt very bad actually. I was happy he said, yes, you speak properly, but I wanted to hold a competition. So I held a competition in which we had events in Kannada. Debate ಮತ್ತು whistling competition. Anta kaladnalli nobody used to do whistling. We did whistling competition. There was one fellow called Jittu. He was very good in whistling. I had the competition. That one fellow now is a top bariatric surgeon.
Okay.
Even today he tells me, Shabir, I'm so happy. See you. So those things make you happy, alwa?
ಹೌದು.
Living for other people. Because you give other people, you will not lose anything. Honestly.
ನಿಜ.
You become even happier. So don't worry about it. The third tip to give you is make sure you take care of your body. Because this is the same body that will come with you when you're 90 years old. Take care of your spouse. Because when you're alone, the children have left the house. Your wife will remember all the bad things you did. So make sure you treat them properly. Treat your children nicely. Because you want to see the grandchildren. And make sure you save money for you and your wife. Children can make their own money as well. But make sure you don't have to beg or ask anybody for money when you're old.
Nija.
These are the pearls that I want to share with you.
ಥ್ಯಾಂಕ್ ಯು ವೆರಿ ಮಚ್ ಡಾಕ್ಟರ್ ಶಬೀರ್. ಬಹಳ ವ್ಯಾಲ್ಯೂಯಬಲ್ ಇನ್ಫಾರ್ಮೇಶನ್ ಕೊಟ್ರಿ. ಅಪಾರ್ಟ್ ಫ್ರಮ್ ಸೈಕಾಲಜಿ ಬಹಳಷ್ಟು ಬೇರೆ ಬೇರೆ ವಿಷಯಗಳನ್ನು ಹೇಳಿದ್ರಿ ಹೇಗಿರ್ಬೇಕು ಅಂತ. ನಿಮ್ಮ ಸಮಯ ಕೊಟ್ಟಿದ್ದಕ್ಕೆ ಬಹಳ ಥ್ಯಾಂಕ್ಸ್. ನಿಮಗೆ ತುಂಬಾ ಧನ್ಯವಾದಗಳು. ಮತ್ತೊಮ್ಮೆ ಸಮಯ ಸಿಕ್ಕಾಗ ನಿಮ್ ಜೊತೆಗೆ ಮಾತಾಡ್ತೀನಿ ಡಾಕ್ಟರ್.
Definitely happy to do that. Thank you so much. ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. Thank you so much.
Okay, thank you very much ಡಾಕ್ಟರ್ ಶಬೀರ್. ಇದಾಗಿತ್ತು ಡಾಕ್ಟರ್ ಶಬೀರ್ ಅವರ ಜೊತೆಗಿನ ಇವತ್ತಿನ ಇಂಟ್ರೆಸ್ಟಿಂಗ್ ಇಂಟರ್ವ್ಯೂ ಸೆಗ್ಮೆಂಟ್. ಮುಂದಿನ ವಾರ ಮತ್ತೊಬ್ಬ ಅತಿಥಿಯ ಜೊತೆಗೆ ಅಥವಾ ಮತ್ತೊಂದು ಸಂಸ್ಥೆಯ ಜೊತೆಗೆ ನಿಮ್ಮ ಪರಿಚಯವನ್ನ ಮಾಡ್ಕೊಡ್ತೀನಿ. ಅಲ್ಲಿ ತನಕ ಚೆನ್ನಾಗಿರಿ, ಖುಷಿಯಾಗಿರಿ. ನೀವ್ ಕೇಳ್ತಾ ಇರಿ ನಮ್ ರೇಡಿಯೋ. ಯಾಕೆ ಅಂದ್ರೆ ಕನ್ನಡ ಕೇಳೋ ಮಜಾನೇ ಬೇರೆ.
196 ದೇಶದಲ್ಲಿರುವ ಕನ್ನಡಿಗರನ್ನ ಒಂದಾಗಿಸುವುದೇ ನಮ್ ರೇಡಿಯೋ.